Welcome to the Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. But before we get started, I'd like to thank our sponsor, locumstory.com. If you're considering locum tenens, either full-time or on the side, you probably have a question or two, or 20. Fortunately, locumstory.com has the answers you need. It's packed with unbiased information and advice from physicians. Locumstory.com has nothing to sell. It's simply an information resource. You'll find super handy tools that let you see locums trends for your specialty, compare different locums agencies, and there's even a quiz to help you decide if locums is right for you. Locumstory.com is the perfect place to start if you want to learn more about locums. And now I'd like to welcome our guest, Jarin Dana. Welcome, Jarin.
Thank you. Thanks for having me, Dr. Wilner. Happy to be here.
So, Jarin, I see there's a big sign behind you that says Nalto, and you are the president-elect of Nalto. So tell me about Nalto.
Yeah, will do. Nalto it's an industry association. It was established in 2001 by staffing agencies like the one that I co-founded. I don't only serve on the board of Nalto and serve as the president-elect. I'm also the co-founder and CFO of a staffing agency based in near Salt Lake City called Fusion Healthcare Staffing. But with my role within Nalto, we look to create and enforce strong industry standards and practices for the locum tenens industry. We like to stress things like honesty, objectivity, integrity, and competency across our member firms. And our goal is to set clear and effective parameters of behavior for all individuals that are affected by the industry, like physicians and clients, and the patients that they serve, which is the ultimate end goal, of course. Interestingly enough, NALTA is the only professional association of temporary physician staffing firms, or locum tenens, as everybody calls it, that is committed to a code of ethics and maintaining highest industry standards. So that's what NALTO is. It's obviously an acronym. It stands for the National Association of Locum Tenens Organizations.
Now I did my first locums assignment in 1981. That preceded Nalto. But if I wanted to be a member of Nalto, is that open to me, or is it only for organizations?
It's only for organizations to be a member in full standing, full membership, for agencies that staff locum tenens. And there are certain requirements in our bylaws to help, define what a locum tenens organization is. However, we at Nalto are blessed to have support from a lot of affiliate members. So if you are not a locum tenens organization, you can become an affiliate member, or you can become a vendor member. And that's usually an organization that takes a sponsorship role at our conferences. They would be organizations that provide ancillary services to locum tenens organizations, like medical malpractice or rental cars for travel purposes. We have a lot of vendor members that deal with travel related items. So you could become a vendor member if you wanted to do so.
Okay, so when I put together my book, The Locum Life, I made a list of locum tenens staffing agencies. You mentioned that you were the co-founder of, is it Fusion something?
Fusion Healthcare Staffing.
Fusion Healthcare Staffing. And well, it turned out to be a long list. I think I hit about 100 of those or so. How many are members of Nalto approximately?
Today we have 83 members and 4 affiliate members. And so the majority of your list was probably Nalto members. And that seems to be growing by the day. We get a lot of new companies that, one of the first items of business for them is to submit an application to become a Nalto member. So we're proud that as new companies come into the industry, they're joining Nalto because we'd like to have them join. And we'll discuss today a variety of reasons why that's important for them to be members with us.
Okay, so why is it important for them to be members with you?
Well, I would say it's really twofold. So the first perspective I'll give you is for an agency. The second perspective I'll give you is for a client, right? Because a client has the ability to choose from a lot of
Like a
agencies.
hospital or a clinic who's looking
Yes, exactly.
for a physician or nurse practitioner or someone to do locum tenens to fill the spot temporarily, right? That's the client.
Exactly. That's the client, and the client is either the doctor. In some respects, it's the doctor. In other respects, it's the healthcare organization. So I'll talk about it through their perspective after I get through the perspective of an agency. Obviously, as an agency, we spend a lot of time collaborating and creating and enforcing strong industry standards and practices that we would expect to see in the locum tenens industry amongst ourselves, right? As peers, we become accountable to each other under these standards that we create together. The second is we collaborate on industry specific information that's related to federal, state legislative issues, credentialing standards, medical malpractice, risk management, public relations, education, marketing. We have committees that sort of look at all of these facets of information. And then as we collaborate on it, we provide that as a resource. So we give access to our members to certain white papers, best practices, things that a new member, if they're joining as Nalto members, they can get access to this information and they can avoid a lot of the pitfalls that the other 83 members may have already made over a period of time. So there's a tremendous amount of value add from that perspective. But we also pool our resources, and I'll give you a big example on that, something we're working on right now that's very important. We have pooled our resources and hired a third-party lobby firm called McGuire Woods. And we have been working with them for about a year now. We first started on a defensive effort because there was some legislative introduced or some legislation, excuse me, that was introduced called the PRO Act. And we did not like some of the language in the PRO Act that could have had a bearing on how locum tenens operate as 1099 independent contractors.
Mm-hmm.
And so we were lobbying you had a lot of phone conversations with senators and other representatives discussing that issue. And that was a defensive effort. In the last 6 months, it became a proactive effort. And we're now, we've had legislation that was introduced by Buddy Carter. In short, it's called the Physician Minimization Shortage Act. And it basically is codifying physicians as 1099 independent contractors. And so the resources that we've pooled to go tackle that effort is tremendous. And the 83 members that are part of that have participated in that. They jump on calls with House members and senators to discuss that bill. And so that's a heavy effort that we're doing right now, and we're engaging our membership to do that. So the pooling of resources, and lastly, they get access to extensive networking opportunities with their peers at conferences. And some people might think, well, why do I want to collaborate with my competitors? It's a highly collaborative industry that we operate in, and that should be good news to the physicians, and it should be good news to the healthcare organizations, because if we ever run into a dispute, if I know my competitor, I can pick up the phone and I can call them and we can work it out. Because at the end of the day, the patient is what matters, right? And that is written throughout our code of ethics, to leave the doctors, clients, and patients out of the disputes. And so if I know my competitors through networking and we've become friends, it's easy to work through issues. It really is. And that happens all the time. In the event it can't be resolved over the phone like that, we do have a non-binding arbitration committee that can take on cases. And that's certainly a value add we have as well. So that's the agency perspective. Okay. If I'm a physician or a healthcare system, right, and I'm trying to choose who to work with, obviously our recommendation is to use a Nalto member firm. And that's precisely for the reason of the ethics and the standards that we've set forth, that we hold ourselves accountable to. And if we ever make a mistake on that, any physician and any healthcare organization can submit an ethic complaint to Nalto, and we have a committee that will review it for merit and then work with the agency to resolve that. And sometimes, it's just a matter of resolving a small issue and it can be fixed very quickly, which is the majority of the complaints. And sometimes it could lead to disciplinary type actions and, membership can be revoked. So if I'm a healthcare organization, I would read Nalto's code of ethics and I would feel good knowing that, okay, well, if you're a Nalto member firm, you've at least committed to do that. Now, if the agency doesn't do that, obviously we've got a problem. But by and large, our members have signed up for that code of ethics and agree to operate that way. And that's exactly what a physician and a healthcare organization should expect from a Nalto member firm.
Right. So that's certainly their intent. And I concur with that recommendation. When I made recommendations in my book, particularly for physicians starting out with locum tenens, it's like, well, there's a lot of firms you could pick from. Might as well narrow the list a little bit and choose from a Nalto firm. Now, when I made that list, I think the number was closer to 60 than 80 plus. So tell me what's going on in the locum tenens world. I back in the day, I'm on a plane and people say, where are you going? I say, I'm going to Minnesota. I'm going to work locum tenens there. Usually I get kind of a blank stare and I have to explain, what locum tenens is. But I think, my sense is that this is growing. Is that correct?
It is. We are seeing many providers starting to do locums for the first time, right? You've got an aging physician population that is seeing this as a tremendous opportunity to sort of enter retirement, to become, to take on less work, but have the flexibility to stay sharp and practice. So we're seeing a lot of that. We're seeing a lot of new residents use it as an opportunity to, explore a variety of different practice environments and locations before they settle in. We're seeing healthcare systems, gain a lot more confidence with those physicians that are doing the locums. Their commitment to the lifestyle, right? Rather, there's not as many people that are just dabbling in it, right? These assignments are ongoing for very long terms, and that's because the fit or the match of that assignment is good, right? Obviously, that's why the physician keeps going back and the healthcare system keeps having them. And as long as those staffing gaps keep coming up, which they always will, because they come up for a variety of reasons, right? There's always shortages here, and then there's some there, and that's really our role, is to sort of to navigate that, to find those placements so that the healthcare can be delivered to the patients in need at the time that they need it. And so you are seeing it growing. Demand for physicians is sky high. Job orders across our member firms are probably as high as they've ever been for locum opportunities. And so we think that's a good thing for physicians that are looking to explore that as a career path or as something to do on the side.
Now, for a physician who is considering locums, you mentioned 1099. explain. So I'm a physician. I haven't worked locums before. I got a regular job, not that happy with it. I want to go do locums. So what changes in my life if I become a 1099 employee versus a salaried W-2? Why is that important?
Well, a good question for me. I'm a CPA as well. So, it's going to be a slight change in how you manage your financial affairs around the assignment. Obviously, as a W-2 employee, the taxes are withheld on your paycheck. And so when it comes time to file your tax return, Social Security and Medicare, that's already been taken care of, and your withholdings for federal taxes and state income taxes have been withheld. You just have to file a tax return and reconcile out that amount. A lot of physicians get very nervous going into this, but it really becomes an opportunity to sort of maximize and become even more tax efficient. When you are paid as an independent contractor, right, from an agency like ours, there's no federal or payroll income tax withholding. If you're a non-resident of certain states like California or Pennsylvania, there will still be some state tax withholding. So those are outliers, but for the most part, no taxes are withheld. So you need to get with your CPA and figure out the best strategy and best structure to put in place for that to sort of maximize your tax efficiencies. But it's not something to be afraid of. There's certainly opportunities and a lot of tax arbitrages that are completely legal to minimize your exposure on that front. But sometimes we get a lot of physicians that work it, and then at the end of they'll work as a locum, they'll get paid 1099, and then they'll call me up and be like, "Oh man, I got so surprised and hit with taxes." And they feel like locums is a bad thing because of that. But I'm here to tell you, if it's done right in consultation with, with your CPA, it's not a difficult thing to understand, and you can put in place a structure that you're very comfortable with. But it is different from perhaps what you've been doing in your career if you've only been a W-2 employee.
Right. So just to be clear, when you work on a 1099 as a locum tenens physician, the company, the staffing does not hold back the amount that you would have to pay in taxes, but you will have to pay the taxes at the end of the year when you file your tax return. But they won't be any bigger or smaller, in general, than they would have been if you'd been a salaried employee, with the exception of some, tax strategies that you could use that might improve the situation. But it's not
Yeah,
like you're going to be taxed anymore.
no, other than when you're a W-2 employee, half of Social Security and Medicare is paid by your employer. The other half is paid by you, the employee. When you don't have an employer because you're independent contracted, you're paying both sides of that. So there is a little bit, there is about 7% more tax that you'll pay as an independent contractor. However, that can be drastically mitigated through tax strategy. That's why I say, so because that's going to be 7% higher, we would recommend you talk with your CPA. There's a very common structure that a lot of physicians use. They usually will go set up an S corp. Well, they'll set up a legal entity in whatever state they live, but then they will check the box, is what we call it, check the box with the IRS to become an S corp. And so you'll hear a lot of doctors, sometimes they'll get around the coolers and they'll start talking about this S corp or this corporation thing. And that's the reason they're doing that, is to help mitigate the exposure to that extra 7% of self-employment tax. So it's a little, we're getting a little into the weeds, but it's very common for physicians to incorporate, is what they'll say, right? But they're really an S corp. Yeah.
Well, I'll endorse that, and I highly recommend finding a CPA like yourself
Absolutely.
who is comfortable with locum tenens, because with locums you might file several state tax returns. Work in Minnesota a few months, work in Arizona a few months, like I did. And if anyone wants to contact me, I have some great referrals of people that I have used that have made my life much easier, because if you're a doctor, you might not be an expert on taxes. If you are, that's
Absolutely.
great. But if you're not, get some help. So lastly, why is given that you might actually have to pay more taxes, why is locum tenens attractive to physicians, you think?
Well, I think the answer to that, it could be in a variety of ways. I think flexibility is probably the number one thing that they're seeking, right? When they, when they look to do this. And, there, as I talked about retirees, right? The decision might be different for where they're at in their career, right? If you're a retiree, it could be that, well, I want to get out of the practice that I've been in. I want to lower the amount of time I'm working. I want to travel a little bit more, but I want to stay sharp and I want to keep making money. That might be the reason for a retiree. A new resident could be, like I said, we're looking for new practice environments. Perhaps because they're young and energetic, they're picking up a lot of shifts because they're paying off student loans and they're trying to make more money and they don't have, perhaps a spouse or children yet. So that might be a motivation, certainly for a new resident. If you take someone in the middle of their career, it could be, picking up some extra shifts locally. It could be that they're motivated to help a rural community that they're passionate about or that they're from. And so the reasons go on and on, but boy, I tell you, the top one that we see is typically flexibility. Compensation can also be pretty high on the list at times. If they're traveling to a high demand area, you could expect if it's in high demand, it probably pays a little higher. And so compensation's up there as well. And, travel we see pretty high too. Sometimes people just like to, get out and travel. So
That's great. Well, Jaron, this has been really a nice discussion about one of my favorite topics, locum tenens. Anything you'd like to add before we sign off?
no, I would just, I would put in the plug for all agencies, right? One of the more common questions that can be asked of a recruiter is, what are you guys doing? Like why are you guys making any money on this thing? And sometimes our recruiters can get caught off guard with that, but at the end of the day, there is a tremendous amount of effort in sourcing an opportunity and finding a provider to fill that opportunity. And at the end of the day, we're making a match to deliver healthcare to a patient. That is a tremendous value add in of itself. On top of that, we come in as an agency and we are providing professional liability insurance for that assignment. And that is, in our world today, is not cheap. It is very expensive and it's a hardening market. It's difficult for agencies to get policies, and there's very few carriers that are currently in our space, and that's not a good thing. And so we're working at Nalto to sort of, hedge that a little bit. But that value that we bring, when a doctor goes and works, we pay the doctor, but the hours that doctor worked, that's an exposure that stays not only with them, right? But also with us. That exposure carries on into the future. Every time we go to renew our policy, they look at the hours that have been worked. And so that's a benefit for the providers because they don't have to go get it. We already got it. It's a benefit to the healthcare systems because they don't have to worry about putting that provider on perhaps their policies. And so obviously that's why we go through credentialing and hospital privileging and all those things. But there's a lot of value to be added there, and just want to make sure that that's not forgotten, right? By both parties as to kind of what we're doing. And then on top of that, there's just a tremendous amount of administrative work, from credentialing to assignment coordination to traveling to scheduling. And really a good recruiter for a physician is going to become their advocate. They're going to become their advocate, and they're going to become, really their concierge to their career. And when that relationship is developed with a provider and a recruiter, it becomes a very easy career path to make for a physician. But, someone who's doing it for the first time, is always very nervous. They're nervous about, am I going to get paid? Am I going to have ongoing assignments? Where am I going to have to travel? Am I going to like where I'm going? And a recruiter can really help cover all of those concerns from the outset, and then be an ongoing resource for future shifts. So that's my plug for agencies in general. And as we've touched on quite a bit today, we would recommend that a physician in a healthcare system only use a Nalto member firm.
Jarin, this has been great. I want to thank you for joining me on The Art of Medicine.
Thank you.
Before we close, I'd like to give another thanks to our sponsor, locumstory.com, a resource where providers can get unbiased answers to all their questions about locum tenens. I'm your host, Dr. Andrew Wilner. Thanks for joining us.
This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests, and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com